He went home, he just went by, I've missed this thing. As he took it like this, he just went OD. Before he got back, before he was rushed to the hospital, he has been called to either to glory or to shame. Within 4 or 6 seconds, you are not able to actually catch such person's attention. The person losing interest in that thing. For some of those people are actually entering into insanity, and we are alive watching them go like that. But for some of these people, it is always, they'll be like there's something on their body they want to kill. Mood disorder. This is when people begin to have individuals particularly have disappropriation of mood.
Welcome back on the show, guys. I still have my very, very sweet and intelligent guest with me here.
I'm doing my best.
You're doing your best. A mental health specialist is still here with us. So moving on, guys, we are going to be talking about addiction.
Okay.
We are going to talk about what is addiction.
Okay.
The types of addiction.
Okay.
And I think we'll pick it up from there.
All right. Right. Okay. Let me pick it up from there. There was a quote I once saw by Addison about some times ago, and he said, "Addiction is the only disease that does not allow you to see it as a disease."
Okay.
So, which brings me to my definition of addiction. Addiction is a compulsive, relapsing behavior, which can actually be given to a substance or a behavior despite the knowledge of its harmful consequences. It means that there are 2 types of addiction. Let's just make progress in there. There is substance addiction and there is behavioral addiction.
Okay. I did not know there is behavioral addiction.
Now, substance addiction deals with the use of psychoactive substances. We have alcohol, the psychoactive substance that we have, the likes of marijuana, the mint, the ice, the Colorado. I fear that Colorado. The Colorado, the whole lot of, they have different names. All right, that is that for the, and so many other things. Then the behavioral addiction is the types of we have people that are addicted to gaming.
Okay.
We have people that are addicted to shopping. There's something called shoplifting. There's some certain people, they are addicted to shopping. They just want to go and shop.
Just buy anything.
I'm telling you, there are certain people that they are addicted. All right, they are addicted to the use of internet.
Okay.
And I'm sure you must have heard the types of pornography and pornography.
Yeah.
It's also not that now. That is under the behavioral addiction category. Now, what happens is that the brain. What happens is that there is an influence on the brain reward system. Just like I said, the brain is full of genetic codings and signatures. All right. Now, in the brain, the way this thing works is that when you begin to take this alcohol, when you begin to take this substance, this psychoactive substance, there is a rewiring of the brain that it does, and it now leads to dependence. It is that dependence that results into addiction. What that means is that a person that does work, there are so many of them. There was one of my clients I managed about 3 years ago. At 18, I think he had his first Mercedes-Benz. Okay. He's into internet, all of these online stuffs and all of those things. And so at 18, he's into, and what he does, he doesn't sleep for 72 hours sometimes. He doesn't sleep.
No sleep.
What he does, he just takes this some of this marijuana and all. They are proper. There's a way it is being used in this time. They are properly laced. And when I mean laced, they put quite a number of things that makes it colorful, smells nice, and it takes it. And what we call them, they are called CNS stimulants. They stimulate the nervous system. So in a way that there is a rewiring. So what it now means that what the brain should just normally do, the brain can actually be productive, let's say for 8 hours at a go. Once you begin to introduce it, it can elongate it, rewiring the brain. And because of that, there will now be a dependence on the active ingredients of this psychoactive substance. So it basically means that somebody that just begin with time from various questionnaires, the first experience for so many of them is always a lifting. Oh, you should. Of course, I will not advise anybody to actually go and taste it. Or do a puff. There is an elation that you experience that it makes you feel good. It's for some it relaxes them, for some it keeps them awake, and over time, the body reward system, anything feel good. If it's going to make me make more money, kill and soil.
You can be addicted.
I will do it. If it's going to make me, if it's going to keep me, my eyes awake till I'm able to market and trade online, and I'm able to actually have increase on my turnover. My show. If it's going to actually make me sexually active, my show, and all of those things, if it's going to actually make me strong, I'm sure you must have seen how sometimes some of these athletes, they are tested for dope, because some of those things, it makes them more energetic. All right, now there's this argument that in spaces outside of this place, the likes of marijuana, and of course particularly in spaces like Canada, that some of those things are used medicinally. It is the truth. Now those things are not taken out of, we must be careful not to take them out of context, because those things are used within a measure of prescription. They are taken through so many labs. In fact, one of the other things that people also get addicted to in this substance is opioid, some of these painkillers. I'm sure you must have seen people that actually, let's say they actually have an issue with their blood, and they have blood disorder. People like, let's say, like have sickle cell disorder that people see it. When I was in school, I did a research on sickle cell disorder, and I found out that it can turn a person's life from 100 to 0 if certain support system are not put in place. Why? Because the way, let me just give the way the blood cell is shaped to have, it has this donut shape. Okay. All right, has this donut shape. A lot of things happens on the red blood cells. Yeah. Now in sickle cell individuals, all right, it is sickle shape like this. So instead of it to be like this, so it is now like this. So it means that when it is now going through the blood, it can actually clog in certain places, causing pain. It can clog in certain places, not allowing enough adequate supply to certain places. Now for some people like that, and they come to the hospital, they are always in pain, and you begin to there's such one of those painkillers that we call opioids. You begin to administer it to them, especially the likes of pentazocine. We have patients that legit that you declare that they are diagnosed for pentazocine dependence, and you see some of them, they would have injected themselves in so many places because they cannot bear the pain. However, there is a beautiful way of managing it in a way that you will not be dependent. So what brought us to this place? There are some of those substances, they are not meant for social use. They are not meant to be used to catch feeling. They are not meant to make you feel elation. They are not meant to become an habit. The advanced systems out of this place have put structure in place to allow that these things are taken through laboratory investigations and put into, you'll be surprised that this marijuana, they are from leaves, they are from, that's why we call them Igbo and all of those things. You get, of course not. They are from leaves, in the same way of how certain medications are made, but they are taken through certain experiments. They are taken through tailored made tests, investigations, to see that when they are prescribed to people. And that's why you see in some of these advanced countries, there are certain pharmacological organizations, they are sued. You release the medication into it when it's beginning to cause cancer, they can sue that pharmaceutical industry and be like, this is not correct. Why would this did not pass through FDA, it did not pass through this certain, why was this actually made to happen? So in addiction, just like we have behavioral addiction and substance addiction, especially with regard to substance addiction. In substance addiction, this person have actually now become, there is a reward system in the brain that has actually now made this person addicted to these things. Alcohol is a central nervous system depressant. It depresses the CNS, it makes you feel calm, it brings this cooling, this cool, soothing feeling to you. You feel all calm, you feel all good, you feel good, you're not and all of those things. Over a period of time, it begins to do something damaging, especially to the liver. It fries the liver. Emphasis on fries. Especially, some of those songs, those ones we call pelebe and all those ones that are very easy to just tear, and you just take it. You just tear. You are tearing a part of your liver away. Because over time, it does something to it, and you discover some people calm down with it. At the later part, there are so many people that have been promised long life, but they will not live long. So some of those, and the thing about some of those very little ones that is always in green bottle, those green bottle, silver colored leather, they have the concentration in them is higher than it is needed. So when you begin to invest it, when you begin to take some of this, and don't forget, it rewires the brain reward system, and you become dependent on it. You start seeing it as the one that is making you perform. You start seeing it as the one that is actually giving you edge over things. And after a time, such person will begin to see things like hallucination, begin to come down with symptoms of paranoia, begin to have delusion. There's that which we call delusion. Delusion is like the sister of hallucination. You get Doctor, Professor, Emeritus, and you're like, where are you? Be like, Dangote is a younger colleague of mine. I'm richer than Dangote.
Mental disorder.
It is a symptom of this disorder. I'm telling you. They believe so strongly that this is what this is. You can't, if you try to, anyway, there's a way we actually reach out to them. You ensure that you don't for such people, you don't engage them in arguments. You just bring what is real and begin to engage them in conversation. Psychotherapy. Meet with them. This is what is believed to be true. This is not correct. This is this. This is this. When you begin to come down from your high also, you see those people, when you begin to invest in some of these things over time, hallucination begin to present you. You discover that sometimes, I'm telling you, you discover that over a period of time, you begin to think outside of the space. You may begin to think maybe you are creative and all of those things. But what is happening is the brain is already becoming altered. You will see, even on cigarettes, they will write things like smokers are liable to die young, people are actually liable to have cancer. They stimulate the CNS and they affect it. Cancer is a disease condition basically where there is a proliferation of cells. It means that, imagine that, let's say 50% of nutrients, 50% of blood are meant to just go to the hand, then 200% are going to it. In that vein, it will now be starving other part of the body from getting, and these things, it can result as a result of some of these stimulants. Some people, they have no business with cancer, they have no business with liver disease, they have no business with kidney issues, they have no business with brain damage, but they signed up their contract. The first day they were like, let's just take a puff. Let us say. And the danger of some of these things is that I've seen people, I've heard of stories, of course I've also read of how some certain people's first puff, first taste was the end. The such we call overdose, OD. The first puff. There was a patient like that once managed. He went back home. It was, let's say, it was discharged on Friday. By Monday, he was reported dead. He went home. He just went back. I've missed this thing. As he took it like this, he just went OD. Before he got back, before he was rushed to the hospital, he has been called to either to glory or to shame.
He went. What did he say? He went
OD. He overdosed on the stuff he was using. The likes of the Colorado is even worse. Have you seen some of these videos where some of them were actually taken and start behaving like animals?
Yes.
There is a writing on the brain that a lot of things are being stimulated. There's an agitation within the brain space, causing a lot of things. You will see some of them actually wanting, they will pour water and they wanting to swim on cement.
On cement, yeah.
There was one that NDLA, there's this group that a mentor of mine actually shared, and one went to transformer, was eating his head on transformer, eating his head, and you're like, what is this? But we must not forget there is a rewiring that is happening in the brain, and it is some of this thing that causes it. You know, the likes of shisha too that people take for,
they'll tell you it's flavor.
They'll put flavor. That's what I'm talking about. How they will put flavor just to make it appealing.
Yeah.
To make it appealing for the moment, you will feel that, and when the person is distressed, because one thing we must not forget to always remember is that life will happen. Life will throw a lot at you. Now, when it throws it at you, what will be your result? If your result is this psychoactive substance, then the end is near.
So I think my next question you have gotten into the mental disorder that comes with drug abuse.
Of course, yes. We have the likes of depression. We have the likes of anxiety disorders. We have the like of the schizophrenic issues also. Especially those three. The first one, depression. If you check out people that actually take some of this alcohol with time, predisposing it a time, they may actually come down with depression. With depression. Anxiety disorders also, because it stimulates the CNS, it can actually cause certain imbalance. There's certain thing we call neurotransmitters in the brain. Dopamine must remain at a particular level. Serotonin must remain at a particular level. At an advent where they are not at the same or the appropriate level, there will be chaos. there will be chaos, addiction, and it can shorten lifespan,
Yeah.
and it can also cause someone to lose contact with reality. It also affects social relationship. Yes, there are certain things that you just need is to actually have a conversation, a one-on-one, an heart-to-heart conversation with a person, but you decided to just let me just go and take one or two. I'll feel good. It hampers it begins to bring a person into social isolation, and before you know it, when the person will slip into depression, nobody else will know.
Nobody would know.
And a day will come, you'll be like, that place is smelling, person has died and nobody even knew about it. Some of those things, and even a little, and quite a lot more addiction, and it impairs productivity. It impairs productivity. Imagine somebody that you see a lot of those. Some of them, they are brilliant chaps, intelligent people, and once they begin to give attention to these things, it begins to affect, especially affecting their concentration, ability to be able to. You will discover. I was looking at a paper recently. I was doing a study on generational gaps, and I discovered that the average attention span of a Gen Z in this age and time is just between 4 to 6 seconds. If a Gen Z is reading a thing, if just a normal reading a thing, and within 4 or 6 seconds you are not able to actually catch such person's attention, the person losing interest in that thing. Now imagine somebody that is actually not invested in some of these psychoactive substance. Such person, the concentration will reduce. Such person, they cannot fix their concentration in a thing for a long period of time, and that way you cannot know productivity. That way you cannot experience protected living in so many ways.
It's very, very deep, guys.
Actually it is.
Very, 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 very deep.
Actually it is.
So my question is, before we round this section up,
Right.
my question is, I noticed that the moment people get to addiction, they start doing drugs, they become very dirty.
Right.
They pay attention to things that they should have paid attention to. They would not want to bathe. They just leave everything tattered. And is it that they're already rolling into insanity, or I don't understand?
All right.
You have to beg some people to go and bathe.
Right. You know, one of the symptoms of an individual that is beginning to have drug-related problem, just the one you mentioned, is poor hygiene. They no longer see their priority. Don't forget, we talked about balance when we were discussing mental health, balance, resilience, and purpose. Their priorities now begin to shift. They are no longer concerned about their okay. Their priorities begin to shift, and it is not because they want it to shift. There is a rewiring happening in the brain. And that's why under poor personal hygiene, declining personal hygiene. For some, normally twice a week this person will wash his clothes, but it's going to 2 weeks and 4 days now. He has not put an inside water. You just find a way, just find a way and decline personal hygiene. Another thing is irrational talk. So these are the symptoms you see in people with drug-related. For some people, irrational or aggressive behavior. You see some of these people that we see that are on them, that are, let's say, people used to call agbero. In a way, culture is a thing.
Yeah.
You know how we've attributed that agbero had to be old school, he has thick. Some of those people are actually entering into insanity, and we are alive watching them go like that.
Yes.
Aggressive behavior on a small thing. Driver for me change. Person will just talk loudly, and you're like, gradually entering into problem. Violent. Some of them have violent behaviors. Small things, the person will go and carry machete. I want to. Some of them will start slipping into start having suicidal ideation. Before you know it, suicidal thoughts will come into the place. Before you know it, suicidal behavior in place. Before you know it, such person is beginning to attempt suicide.
Yeah.
For some people, just like we discussed about paranoia, they will start believing that certain people are after their life. Some will just start believing that I am the richest man in this place, I have superpowers. Some you ask them that, what are your powers? They'll be like, I have this one, I
This
have this
one.
one, I have this one. I am like, you,
Where?
how? So it is one of those things. Such people begin to, just like I defined earlier, begin to lose contact with reality.
Okay.
Such person will begin to lose contact with reality, and it will become so much that if care is not given to it, and that is why when those symptoms are beginning to being observed or noted, it's expected that such person are brought to a facility, a registered facility that can actually provide solution to it in time before he actually gets what. Because with time, the more time is left to go on it, the more chronic it becomes the problem. If it becomes more chronic, the prognosis, when I mean the chances of such person coming back, may actually be a little slimmer. So early detection is very important. You see somebody beside you, such person is doing normal, come on, you go your thing free, go indomie, and all of those things. Some of those things actually happen even in some of these university spaces. You just be like, I come on, shy CSE, and discover that wow, only you jade alone if lecture kilo shele. Baba waiting they have, be like, I just do nothing they have me, I just feel. So early detection is very important. This person is not this is not this person's usual behavior. Engage so that progress can be made.
So the last question, I think I thought I had already asked that. How do we get out of addiction?
Right.
Like, what's the first step to get out of addiction? Somebody that is willing to.
Okay.
So.
Alright. I like the standpoint you came from. Insight is one of the major parameters we use in assessing an individual mental state examination assessment. The ability, self-awareness, the ability to recognize, and there are 3 levels of insight. We have absent insight, we have poor insight, we have partial insight, then we have full insight. For a person that actually has absent insight, the person does not see any problem with what he's doing. For someone that has poor insight, the person is like, he doesn't really believe that what he's doing.
He doesn't believe that he's addicted.
He doesn't believe that he's addicted. In fact, he can fight you. He will be like, I'm taking this. I know that. Then partial insight, the person knows that this thing can actually cause me problem, but the person is hesitant to finding treatment.
Okay.
Then the 4th level is full insight. The person knows that this thing I'm doing is affecting me. Where can I get help? So the first thing is self-awareness, which leads to a measure of insight. You have to measure the insight. I see this thing as a problem, and how willing how willing am I to actually receive treatment? When this person comes to that place, it is not unlikely that this person will not come face to face with people in their spaces that will be able to offer social support. Social support is very important in curbing addiction. And for people in behavioral addiction, one of those things you give attention to is accountability. Have an accountability partner. Buy. This is actually affecting me. For starters, for some who have issues with behavioral issues, likes of pornography and all of those things, there are some of those sites now, because some of those things are going on site. There are certain site blockers that are available now. That if you are entering this app will detect that there are certain pornographic content in this place. You're going to go there, and as you don't, and since it will block you from actually getting to that place. In the same vein, for accountability, people that you give rein to be able to check on you, and their words weigh something in your space. Like if they say don't do this, you have a measure of respect for them to do it, which leads to when this social support is granted, then it is important this person seek help in places where they can get. Of course, they can actually into rehab facilities where number one, detoxification will first happen. Detoxification, where certain medications will be given to detoxify the person's blood, because provided these certain people will still continue to have hallucination or paranoia for a long period of time, even after they have stopped, because it is still in their bloodstream. This content is still in their bloodstream, and it has written a code in the blood, so it will take a time. And some of these neuroleptics, some of these when I mean neuroleptics, I mean some of these medication that is given, some of them they take their peak effect. They don't take their peak effect not until after 21 days. So The patient may still be experiencing certain things and all of those things and all. So detoxification is given attention to. It is the blood body is detoxified. And you discover that after a while, such person, have you seen certain people that are addicted before? The way they used to look lean.
Yes, they are.
When they begin to take this medication, take the medication and give attention to some of this wellness treatment, they begin to look fresher, they begin to look human, because the thing that is taken, those nutrients they were meant to take, they were meant to use for wellness, is already taken out of the system, which leads them to adherence to medication. For some people, they will take the medication for a long period of time. All right, medication is given particularly to actually allow for balance of the neurotransmitters in the brain, allow for proper rewiring, as it were, in the cerebral space, which now leads to the final, which is rehabilitation. In rehabilitation, there is a structured system to ensure that the person's everyday life, the person can be able to can have the necessary skill and the enablement of will when person is confronted with some of these things. Because the truth of the matter is, these things are all around us.
Yeah.
You can't walk 1 mile. What am I saying? 1 mile. You can't walk.
Everywhere.
You can't walk and you not see the ability to be able to say no. I was listening to a podcast before I came here, and they said, if you can't say no to yourself, you can't say no to others. In fact, it goes as deep as no is if a whole statement. Ability to be able to say no. Ability to be able to put boundaries. I won't take this.
And I will not take it.
I
won't do this and
I will not do this. Now, it does not. Your will is one thing. The skill to be able to support your will. Because for some people, what brought them to doing those things was because their work was hectic. So they found solace.
Like people that take coffee,
caffeine, and all of those things. You'll be surprised that in Coke there's caffeine. You'll be surprised that in Pepsi there is caffeine. I know certain people that no day goes by. I know a colleague. No day goes by. Of course, he works in the OR, the operating room. No day goes by without not attempting to actually take Coke. And what happened is because Coke actually gives a surge of blood glucose that keeps you up and active. I remember when I was doing my specialty too. When I was in school, it's my specialty then many of the times I don't eat. Meanwhile, maybe I should say this: breakfast is very important. If you are not fasting, feast. Breakfast, according to WHO, is the most important meal of the day. Very, very important. If you are not fasting, it's important that you eat. Now, those times, because of a lot of things, I was the class rep, I had a lot of things on my table. Sometimes I don't eat, sometimes I know. So when I'm coming back, let's say from break, there was a time that solo Coke was common. Solo Coke buy. I'll just get solo Coke, and there was this, I can't forget the name of that, Buluwatife Chin Chin. I'll just get one, I'll just get two, I'll take it. I can be on Buluwatife Chin Chin and solo Coke, just that one and two Chin Chin for that till 6 p.m. And I will be fine. And one day I called myself, I say, you will die, you will die. But I discovered that what I needed, I was getting it from solo Coke. I was getting it from because there is an active ingredient in it. However, after a time, I will discover that it will be difficult. In fact, I will prefer Coke to wanting to eat. So rehabilitation skills that, okay, what are other things you need to replace these things with? Healthy replacement. That instead of taking Coke, what can I do? I devised the means recently, because sometimes you can actually really be at work for a long period of time, and so I devised the means. So instead of what I just do, I just get fruits. I get fruit together. When I get them, I just blend them, smoothie. I will just put them inside the freezer. I will just take a 500 ml bottle. Just take that. Once I'm taking that, you can evidently substitute that. Now that one is more healthy. That one actually has less complications, and it gives you the required glucose you need to go through your day.
Thank you so much for this section. Really appreciate you. Guys, we are going on another break. Stay with us.
He went home, he just went back. I have missed this thing. As he took it like this, he just went to D. Before he got back, before he was rushed to the hospital, he has been called to either to glory or to shame. Within 4 or 6 seconds, you are not able to actually catch such person's attention. The person losing interest in that thing. For some of those people are actually entering into insanity, and we are alive watching them go like that. But for some these people, it is always, they'll be like there's something on their body they want to kill.
Okay.
Mood disorder. This is when people begin to have individuals particularly have disappropriation of mood.